A Mayo Clinic study confirmed that getting a second opinion cuts the chance of a misdiagnosis in half. And today on Transmissible, a public health podcast, we're talking all about how getting a second opinion can improve your healthcare outcomes. Hello, everyone, and welcome to Transmissible, a public health podcast. I am your host, Jessica Stahl, and I have spent most of my career as a contractor with the Centers for Disease Control and Prevention. I also have my Master's of Public Health with a concentration in epidemiology, and this is my passion project. If you've been around, this is 90% public health, 10% kind of the background and like what's going on and how you start a podcast when you're in your last semester of your MPH program and you are freshly postpartum. Every week we dive into a new topic. Today it's healthcare outcomes and second opinions. We've done in the past typhus, rabies, dengue, public health challenges during wartime, Rocky Mountain spotted fever. Let's see. We've done 2 episodes on bird flu, and those are very, talking about an incident that's occurring right now in our backyards. So I highly recommend jumping into those. Last week we covered water splash pads and the pathogens that can be lurking in those if they are not properly treated. And yeah, this is kind of a casual conversation. I want you to picture it like you're sitting here talking to someone who just spent a week deep diving on a nerdy public health topic. And I've just had so much fun putting this podcast together. And I think this is episode 19. So we're getting out there. My goal was I would do 21 episodes and I would then reassess if I liked doing this. And I can say at episode 19, I do really like doing this. So we're just going to keep on plugging away. As always, this is not medical advice. This is just me presenting information that I have found, and definitely talk to your own doctors, your own team of medical professionals about your own medical questions and concerns. And yeah, I took 2 weeks off. We went to Montreal and Vermont. We were just kind of traveling, and then just life got really crazy and I'm back. I'm excited to be back. It is July 7th. I'm recording this. This will be out July 8th at 6 a.m. Eastern time and bright and early Monday morning. So we're back in the groove. Maybe we can call that like my little summer break. But yeah, so I'm back and this is just once again so fun. We were in the charts again, or 2 times since my last recording. So we've been in the Apple Podcast charts 8 times. People from 22 different countries are listening to this podcast in almost every state of the United States. And just once again, I am just enthusiastically excited about that and just have so much gratitude. And thank you so much for everyone who has, participated in this experiment. And so I just thank you. I really appreciate that. And this has just been a really fun project. So that's kind of the updates, the housekeeping. This episode is near and dear to my heart. It was inspired by some true life events. I don't talk about it in a ton of detail, but my son, who is, he will turn 2 this summer, but he has had just kind of a crazy roller coaster of kind of some just weight gain issues and growth issues, and we've just been to so many specialists and gone down so many routes of trying to find something that's wrong, and thankfully nothing's wrong, and he's actually experiencing a little bit of a weight burst, I guess you could say. He's crushing it, and so hopefully, knock on wood, we're maybe exiting this time of medical stress, and I plan to tell this story a little bit more. I guess we could just jump into the actual topic, but basically we got this medical recommendation that was extremely intrusive, and it was a very big procedure. I was there at the doctor's appointment alone. All things being considered, I like it when it's my husband and I both there, but he had to work, so he was, he comes in on speakerphone and stuff like that, but it was a weird appointment, and the recommendation was very firm. I think there was a little bit of trying to scare mom into saying yes to it. And, ultimately I said no. And my husband and I just totally aligned that we were not comfortable with this procedure for our son. And then we got a second opinion, then we got multiple other opinions, and everyone else said no. And it just really got me thinking, there's an enthusiastic no from everyone we've talked to about this, including my own gut, which is, I would say scientifically trained. My husband's a physician himself. His medical gut is something I really value. And, we were saying no. The second opinions are like, absolutely not. This is not the time for that. But it just really got me thinking about, what if I didn't have the education or the background or the life experiences of knowing, hey, that's a really big deal. We got to get a second opinion before we say yes to something like that. And I was just, I was sitting in these doctor's appointments thinking how grateful I was that I had the tools in my toolkit to know to seek out different things. And we could have been sitting and, getting an operation on, my little toddler that was unneeded. And it just really inspired this podcast. I was digging into the statistics behind second opinions for my own sake, just because the public health in me was just like, I got a deep dive. I wonder, what the epi is behind this. But, and as I dug into these data, it's overwhelmingly clear that you should get a second opinion when there is, especially if there's something important on the line, or if there, surgery is involved, if cancer is involved and stuff like that. And so I thought, I was actually doing research already. I was going to do a podcast episode on the common cold, and I still will do that because I got a lot of the research done. But I totally derailed, and that probably also contributes to why there's been a 2-week delay in this. But I basically prepped 2 episodes, but I prepped this one. Once again, it's probably a tiny bit shorter than our average. I think typhus was an hour and a half. But I really wanted to present these data sets, because I think it's so important that this is out in the public, and it is, because I found it on the internet, and it's pretty clear on, if you're searching this, in Google, that you should definitely go down the second opinion route in most cases. But I just thought, let's put it into the airwaves. Maybe this will reach someone who was in my shoes, sitting there scared in an appointment, hearing this recommendation that just makes your skin crawl a little bit. And then to get the overwhelming response from medical professionals saying, no, don't do that afterwards. It's definitely something that, if someone is going through that, I would want them to know, hey, get another opinion. And maybe that first opinion's correct, but now you have a little bit more peace that it is correct. And at the end of the episode, we will talk about the barriers to a second opinion, because it's really easy to say, hey, get a second opinion. But as we will go over, there are a lot of barriers and things that can prevent someone from getting a second opinion, from finances to accessibility to just, the understanding of the situation, or, there's a million things. So we're going to talk about that. But I guess let's jump right in. Like I said, this might be kind of a shorter episode, and I'm going to pause it just for a second to make sure my speaker is working. I don't know, because I took a 2-week break. I feel like all of my audio settings have changed, which is not true, but let me just pause it for a second to make sure this is working correctly. All right, the microphone is working. Once again, if you have a recommendation for a good podcasting microphone, please email me at transmissiblepod@gmail.com, because now we have an email account, but I don't love this one. It's the toner. I feel like it makes my voice a little bit flatter than it is in person, and then when I hear myself back on an iPhone or something. So shoot me that rec if you have one. I know I can Google it. I have Googled it. This one was recommended. So, if you have more hands-on experience with this than I do, let me know. But let's dive into the data of patient-initiated second opinions and how they do improve patient outcomes. So according to the Cleveland Clinic, second opinions lead to a diagnosis change in 28% of cases. This means that almost one-third of patients, their initial diagnosis was either incorrect or incomplete. And when it comes to the treatment plan side of things, 72% are modified or were modified in this study after the second opinion. So this shows that even if the initial diagnosis is correct, there may be room for improvement in the recommendation course of action. And this was taken directly from the Cleveland Clinic's website. Something that's interesting is this is something that is growing in popularity, and people are able to do this more. So the global medical second opinion market size in terms of, financially is at $7.12 billion in 2024 and is expected to grow or to be worth, sorry, my Steam account just popped, is expected to be worth around $20.48 billion by 2031. So that's growing at a rate of 16.3% from 2024 to 2031. So this is a growing industry. This is popular. I think that's really important because sometimes it feels awkward to get a second opinion. And it's important to note this is not rare. This is very common, and it is a huge corner of the medical industry. A Mayo Clinic study confirmed that getting a second opinion cuts the chance of a misdiagnosis in half. So this is a different study. Basically, all these studies say the same thing, and that is that it is good medical practice to get a second opinion, but their numbers are a little bit different, right? We see that in studies. So I'm just going to go through these studies, and at the end of it, the numbers will be a little bit different, but the overall, the main thesis point is that second opinions are a good thing. So this Mayo Clinic study confirms that getting a second opinion cuts the chance of a misdiagnosis in half. These researchers analyzed functions of the second opinions in correcting diagnostic errors and professional or unconscious biases, including ego and hindsight bias, as well as financial interest. So this is a study that is looking at all the different factors of it. They're accounting for these different factors of why the second opinion leads to a a cut in diagnoses. This is also one of the studies that looked at a third opinion, so not the second opinion, but the third opinion, and it drove the rate of diagnostic errors down further to 16%. So they're saying second opinion's great, third opinion, in statistically speaking, is even better. There is this earlier study, so that study was Mayo Clinic. There's another study by Mayo Clinic from before that found that 1 in 5 patients received a distinctly different diagnosis from their second doctor, contrasting the first and second diagnoses of patients referred to specialists. The study revealed that out of the 286 cases reviewed, only 12% received a second diagnosis that matched the first. That is a mind-blowing statistic. The remaining 87% of second diagnoses, out of that number, nearly 9 out of 10 patients, oh my gosh, sorry, I wrote these notes weird. So of the remaining patients, which is 87% of them, which is 9 out of 10, led to either a refinement of the first diagnosis or a distinctly different diagnosis. So as we can see, getting that second opinion is just good medical practice, and who, statistically speaking, is more often to get these second opinions. So that's, we're wearing our epi hats here. So who is getting these second opinions statistically? So we look at the data. Sorry, I did these notes weird. This is what happens when you take 2 weeks off. So seeking a second opinion was more common in women, middle-aged patients, more educated patients, and people who have a chronic condition with higher income or socioeconomic status and that were living in central urban areas. So we're going to break down why that might be, and also kind of the flip side of that, the factors that are preventing some people from getting a second opinion. But why are these people getting it? According to Yale Medicine on their website, there's a really great article, it's linked in my body, of why are people getting second opinions? And these are the reasons they said: when it's cancer, when surgery is recommended, when the diagnosis or treatment is unclear, when the patient is your child, and when you want peace of mind. Those are the main reasons when they interviewed these specialists about second opinions, that they said those are the reasons that they see people seeking them out. But as we can see, and I think if you're sitting in a doctor's office, a lot of the times it's yeah, it would be nice to have a second opinion, but what is preventing you from that? So these are things that I wrote down. And if there are more, I would love for you to email me or message me on TikTok and tell me the reason why you were prevented from getting a second opinion. What was your barrier if you wanted one and you were not able to get one? But here, I'm just going to kind of rapidly go through them. Awkwardness feels dangerous in a medical situation. This is one of mine, is I'm keenly aware when I'm in a situation, not just medical, I mean, this applies to a lot of different areas of life, that if I become this problem patient, this woman who's irrational, this, she's quote unquote freaking out. If some of these labels that you feel like you're not freaking out, you feel like you're not being irrational get put on you, then it feels dangerous because it feels like, oh, they're not going to try as hard. Oh, they're going to, cut corners, or they're not going to put their best foot forward. I want them to treat me like they're treating their family member, not like they're treating someone who they don't like. And so for me, some of the things that come up when I'm trying to advocate for my health is just awkwardness feels dangerous in a medical situation. And I've read a lot about this. I'm actually listening to a really good podcast called The Retrievals. And this is brought up there, is that especially women, you feel like you have to ride this middle ground of, I need to be assertive and advocate for my health, but I need to play a little bit dumb almost so they still like me, because I want to be assertive and I don't want them to cut corners, but I also don't want them to dislike me and then cut corners, or even subconsciously treat me differently, right? So that's one of the big barriers. And I'm putting these website links, but AARP actually has a really good website on this, or a really good blog post on this. And it says, this is common medical practice. It is not awkward. And you don't even have to have your doctor involved. So a lot of times a second opinion, and this is what we've done, sometimes you do need those medical records, and that's fine and that's common. Don't feel weird about calling your provider and saying, hey, I need these medical records sent elsewhere. I need a second opinion. My husband and I have done that in the past 4 months. And it was fine. They understand, because it happens more than you feel like it is happening when you're the one doing it. But you also don't need your doctor's opinion, because you can go off and get a second opinion from a totally clean slate. Kind of depends what the diagnosis is, or what condition you're working with. But sometimes you can just do a clean slate. They don't even know you're there for a second opinion. Or you can tell them, hey, I'm here for a second opinion. We have done all of the above. And it has never been awkward. And also, according to my husband, who's a physician and who has seen people in a second opinion capacity, he's been the second opinion. He's had people, he's a oncologist, so sometimes people will get, their local opinion, and then they'll fly out to MD Anderson and they'll get a second opinion. He's been on both sides of that, and he says it's not awkward, and he agrees it's good medical practice. I mean, we're doing it for our personal lives, but he also said, if a doctor is defensive about that, that's actually a pretty big red flag itself. So keep that in your mind. If they're offended by that second opinion, that might be a red flag. Unless it's you need surgery, life-saving surgery tonight. We'll talk about that. One of the barriers is if you don't have time for a second opinion. But also going down, it's expensive. It's freaking expensive. I have had no insurance before. I've had bad insurance, health insurance, and I've had good insurance. And I've been on that side of, it is cripplingly expensive to get to this appointment. I'm supposed to get another appointment just to confirm this first person's opinion. It's very expensive. That is a huge barrier to second opinions. I think it kind of speaks for itself. It's expensive to get the appointment. It's expensive to drive there. Some people don't have a car. It's expensive to ride the bus. It's socially awkward or unattainable to get someone to give you another ride. Maybe it took you a lot of time just to get one ride to your first appointment. Now you're asking for them to give you another ride to another appointment, maybe further out of town, maybe in a different town. Cost is very prohibitive in a lot of second opinion situations. Another one, time. If you need life-saving surgery that night, you don't have time for a second opinion. I personally have not experienced this for myself, but I actually experienced this for my cat. My cat got attacked by a dog. Gosh, now it's been 7 years ago, but it was a horrific attack, and they said that they could give her surgery. They didn't say that they could save her. They said we would try. They did save her. Now she's just like chilling in her house as an old lady cat. But I would have loved to have been able to get a second opinion just for cost, because it was like, this is going to be a very expensive surgery. I would love to see if I could get a second opinion, maybe a cheaper surgery, because I was a broke 25-year-old, but my cat did not have the luxury of time. So obviously it's a little bit different. Humans and animals are different, but that was a good example. She just had to go into surgery. I didn't have time for a second opinion, and human second opinions are like that sometimes. You don't have the luxury of time. Lack of access to another doctor. We kind of talked about this, but in the epi portion, it said someone living in a central urban area is more likely to get a second opinion. And yeah, that makes sense, because you can go 20 minutes down the street and have another specialist. But if you're in a smaller town, maybe a rural setting, maybe you drive 3 hours for that first opinion. Like, if you drove to that big town, maybe there's more in that town, but maybe now you have to drive 6 hours for that second opinion. Maybe you have to get on a plane for that second opinion. And that feels so burdensome. Or maybe you don't have a car, and so you walked to your first opinion. The second opinion requires you to go across town. You physically can't get there. You can't afford to get there. You don't have the means to get there. So lack of access to another doctor is a huge factor. Telemed is filling this gap a little bit, and I think that probably contributes to why this industry is growing so quickly. It's like, yeah, I can't get physically to my second opinion, but I can jump on a Zoom call. I can go to the library and use their Zoom and get my second opinion. I can show them the scans from that first doctor, and I can get a second opinion on those scans. So that is a huge industry, and I hope it just like absolutely takes off. So my next factor is lack of understanding, the inability to compare the options, or feeling overwhelmed by more data. If you're already kind of overwhelmed by the diagnosis, and if your medical understanding or background is limited, adding more opinions might seem overwhelming. So now you have two people who you consider both of them to be smart and competent telling you different things, and I think in some cases for some people that might feel like it's making the process harder. It's like, I don't know, tell me what to do, and I have felt that way. More data, for me, more data comforts me. I'm soothed by more data, but sometimes you have a lot of data and it's like, okay, well, who's right here? And then so you have to do your own research. And, for our family, we have, some of that educational background to help us splice through it. But at a certain point, I've said this term, sometimes there's too many cooks in the kitchen, and this is another barrier. And then finally, I just have that you don't know that's an option. I think a lot of people don't even consider a second opinion as an option when they're thinking about this, because, there's so much going on. You're scared for yourself or for your loved one. There's, you just have this scary diagnosis. Maybe the diagnosis is true, but you don't know the treatments. And so you're, mourning the fact that you got this scary news, and, you just don't consider that that's an option. And that's one of the reasons I'm doing this podcast. I'm kind of an amateur, so I hope it's coming out clearly and the data is getting presented well, because I want everyone listening to this to know it usually is an option if you are able to basically to afford it. And if you can't afford it, and if you have the luxury of time, you should really get a second opinion. Those are what I consider the barriers. I would love to hear what you consider the barriers and what you have experienced in your own life. And, this isn't just for medical stuff. Like I gave the example of my cat with the vet. This is true in veterinarian circumstances. This is true for dentistry. My husband and I always get second opinions on dentistry, because we've both had kind of a situation happen in dentistry and physical therapy. It never hurts to get more eyes on the subject. So how do you make this happen? They're basically, according to AARP, which I really liked this blog post, so definitely check it out. But there are two paths forward when you want a second opinion. One is with help from your physician, and the other is without. So in what they say, and I love that they put this, it says, remember, you do not need your doctor's permission to seek a second opinion. And for some patients, it's important to go into the secondary consult with a blank slate. So kind of depending on what your illness is or your sickness or your diagnosis, they don't even have to know. You could go get a second opinion. They say, yeah, I agree with, doctor number one, and you just go back to doctor number one and you do it. There are a lot of circumstances of why you would stick with the second opinion. Maybe if it's a different treatment plan and you like that one better, but they can also confirm that that first one was correct and maybe that one's closer to your house, so you stick with the first one. But they don't need to know, or they can know, and you can send them all the records and the scans and the labs and all that, and then they can kind of check the first doctor's work and they can say, yeah, I agree with that, or no, I don't. And I keep saying doctor, but technically this is just medical professional. It could be a nurse practitioner, a PA. That is also something, it's a little bit of a sensitive topic. I really wanted to go to PA school for a while, so I have a special place in my heart for the industry, and I love PAs, but I know in our family, like our parents and stuff, we've had PAs or NPs give an opinion, and we've said, hey, let's wait a little bit longer for the appointment, let's do it, let's get a medical doctor's opinion. And sometimes it's matched up and sometimes it hasn't. As we can see with the data, that happens with doctors too, but sometimes you want someone who's spent time going into a residency and maybe just has more time in the field or more educational background on the topic, or just a specialist. You could get an opinion from your primary care doctor, and you're like, hey, this is kind of what happened with our son. It's like, hey, I want a specialist in this. So then you go and you seek out a pediatric blah, blah, blah. And, it's someone who only focuses on that. And, there's a lot of different kind of ways this looks. But, that's basically it. That's my data. And I think it speaks for itself. I will put some of this data. Sometimes I like to see the numbers on a paper instead of just hearing them. So I will put it in the body of the podcast. But basically, let's just go over them like really quickly. So according to Cleveland Clinic, when it comes to treatment plans, 72% are modified after a second opinion, and 28% of the cases led to a diagnostic change. If you go down to Mayo, 1 in 5 patients received a distinctly different diagnosis from the second doctor. And of the 286 cases that were reviewed, only 12% received a second diagnosis that matched the first. And also, just as like a side note of that first opinion might have been the correct one. Just because it changes doesn't mean it's always going to be the correct one, but at least you have more information and more data to work with. For Mayo, the remaining 87% of the second diagnoses led to a refinement or a distinctly different diagnosis. So 9 out of 10 patients had something tweaked from their first diagnosis. So obviously, I think we can see from the data that it's a good thing. My personal experience is that it has been a good thing. And sometimes the first one's correct. In college, I had this issue with my foot. It was like a whole thing. I won't go into the details. It's like minorly gross. But the very first, my college nurse was correct. She was seeing, we were lined up. There was just so many of us college students going to that clinic. She was just rapid fire seeing these people. She gave me an off-the-cuff diagnosis of my foot. I was out in Milledgeville. I go back to Atlanta. I'm going to all these specialists. And lo and behold, like 6 months later, that nurse, her diagnosis was correct. And so, second opinions can tweak it, and maybe that first one's still correct, and that's where the personal judgment and each situation being unique. So I've had experience where the first one's correct and the second opinions were incorrect, and then now with my son, I've had exactly the opposite, where the first one was incorrect according to us, and it would have been a very invasive procedure that he didn't need. And with every single procedure there's risk, and so I am very grateful that we didn't have to go through that. And I don't envision it needing to come up in the future, but if it for some reason in the future we did need to go down that route, I guess at least he would be a little older, but hopefully we don't. So that is this episode. That's kind of all I got. I hope you guys enjoyed it. I will be back next week. I'm officially back on the week-to-week grind. Monday mornings, bright and early. I want you to be able to be driving to work or signing in to whatever you're signing into at home, or going to school, or waking up and starting your week you know, as a stay-at-home mom or a student or, you know, someone who's working full-time or part-time, or, you know, you're in med school or you're in MPH school, I want you to be able to start your week with this very casual episode where we're just kind of chit-chatting about something that I have deep dived, and I'm just so grateful for the overwhelmingly positive feedback you guys have been giving, and the follows and the likes and the shares and just the listens. Like half the reason I love this podcast is I love the data behind it. I just am such a data girly, and I love seeing where you guys are listening from. I can't see very specific data, but I can see, for the United States, I can see city, and for globally, I can see country, and it kind of depends on the country, but I can either see region or I can see city. So for the United States, when you click on it, you see, first of all, it says United States and it says the state. So it'll say like Georgia. Then you click on Georgia and it says like Atlanta or Beaufort or something like that. But then for like Ireland, shout out to my Irish. I too am Irish. I feel like that was awkward, but I can only see region. So I can just see that like there's a region of Ireland that's listening. But then like Moldova, for example, I can see the cities in Moldova. So it's just kind of interesting how, I think it's the country's regulations and how they're able to present the data to someone looking at it like I am. But I love that aspect. So please like, follow, share, set a reminder. If you follow on Spotify or Apple Podcast, it'll alert you when a new episode comes out. I find that to be helpful, but it also just helps in the charts. You know, I'm a chart girly. I love seeing that. So just thank you so much for being here. If you have a story about getting a second diagnosis, or you're a professional and you want to add something, please shoot me an email at transmissiblepod@gmail.com. I would love to hear your stories. I can share them on the podcast or I cannot. It's totally up to you. Just tell me in the email itself, or just email me and say, hey, I'd love getting an email. So I started the email with the last episode, and spoiler alert, I have not gotten an email. So someone please email me. But I have heard from you guys on TikTok, so that was kind of our route before that. So I think that one's just a little bit more ironed out. And one more thing, I got stickers. If you follow me on TikTok, you've seen this, but I got transmissible stickers. They have a little QR code. So if you want a sticker, send me a DM or an email with your address, and I will send you for free a sticker. Preferably in the United States. I think it gets really expensive if I ship them overseas. Back in the day when I had my Etsy shop, I had an Etsy shop in college, and it was like fairly successful, but my orders that went overseas were just like, the shipping cost like more than the product. So I don't know if it makes financial sense to ship the sticker overseas, but if you're in the United States or maybe Canada, I think we kind of like share some routes. So send me a DM with your address, and I would love to send it to you, and then stick it somewhere where stickers are allowed. I did a deep dive because I was like, is this going to be vandalism? And it is vandalism if it's not like an already like stickered area. So no vandalism charges for this community, but we do love stickers being stuck. So I put some in Breckenridge over the weekend, and I'm going to kind of put them in the ski towns when we go up there because there's just stickers everywhere. So that's my tangent. It is a beautiful, bright, sunny day here in Denver, Colorado, and we are going to go outside. I think we're going to go for a walk, maybe a hike. I don't know. My right calf has been cramping really bad, so maybe like a shorter one. I should do an entire episode on hip and leg issues because it hits me very personally. I got in a car accident, and just, I don't know if the car accident did this or if the car accident hurt me more because I have kind of a susceptibility to some stuff, but I just have real issues with like my hip flexors and my calf, and it's a whole thing. That's a story for a different time, but thank you guys so much for listening. I just appreciate you guys so much, and I'll see you next week, bright and early Monday morning. Bye.